Hello everyone, my name is Dr. Wajid Sibir and I am working as a MTI doctor in UK for nearly 2 years now, which means that I am almost at the end of my MTI contract. So I thought that I should make a video based on my experience about the MTI process. So those of you who are planning to take MTI route to work in UK, they would benefit from my experience. Few months ago, I made a video about MTI route through CPSP, which is mainly for Pakistani medical graduates who were under CPSP training program. But in this video, we'll discuss MTI program in general, which applies to any medical graduate from any country. So we'll discuss step by step about the eligibility criteria, about the application process and interview, and at the end we'll have a quick look at pros and cons of working as a MTI doctor in UK. So MTI is basically a scheme which is designed for international medical graduates to work and train in UK, and it is run with a collaboration among Royal Colleges, deaneries and trust, and Academy of Royal Medical Colleges. So all of these institutions, they work together to assess the eligibility of the candidate, to find out the jobs across MDI post across the NHS, and then to help with the GMC registration and with the application process if the candidates are successful. So coming to the eligibility criteria, which is by far the most commonly asked question. So every Royal College has a different set of eligibility criteria, although the core is the same, but there are some variabilities among them. In this video, we'll mainly discuss the eligibility criteria by Royal College of Physicians. The reason being, most of the MDI posts, they are in medicine and allied. But if you are from another specialty, you are looking forward for MTI process, you can check the relevant college website for MTI eligibility criteria. So to be eligible for MTI route, you should qualify all of the following criteria, which includes primary medical qualification, which should be recognized by GMC, and your qualification should be verified by the EPIC. What is EPIC? You can go online and you can search. Hopefully, you'll um, get the guidance, but we won't discuss it here in detail. This primary medical qualification could be MBBS or equivalent. The next is some basic postgraduate qualification, that is like MRCP, MD, or equivalent like IMM, that is intermediate module. Nextly, you should have a 3-year postgraduate experience, which includes 1 year of internship, that is house job, and at least 1 year experience in the specialty you are intending to apply for. You must be in clinical practice for last 3 out of 5 years, and among these you must be in clinical practice for last 12 months with no gap in employment, otherwise you won't get GMC registration. Another one is you must not have failed a PLAB examination in past. You should have a valid OET or IELTS certificate, and you need to provide a certificate of good standing from the country where you have practiced for last 5 years. So this is the main eligibility criteria for MTI route by Royal College of Physicians. Now next is the application process. So once you are happy that you fulfill the desirable eligibility criteria, you need to fulfill an initial form and send it along with your CV to Royal College of Physicians through email. I have given the link for this initial form along with the email for Royal College in the comment section. You can have a look at it and you can copy it from there. So once you have sent the email along with the initial form, the Royal College of Physicians, they will respond you through email within 10 working days. The Royal College, they will send you an application pack which you have to fill and send it along with some of the documents which are as follow. They require you to submit two sponsor forms. These forms are to be filled by your head of department or the consultant you are working with. There will be two reference forms which have to be filled and written by two of the consultant which you are working with or you have worked with in the past. Also, you'll need to send two copies of your passport. You'll have to provide the IELTS and OET certificate, copies of your medical qualification, and a letter from dean or principal of medical university or school where you did your graduation from, along with the RCP fees of 100 pounds. So once you have sent back this application pack along with the required documents, you will be shortlisted, and if you are shortlisted you will receive an email for job interview. Now the interview, it is an online interview which is basically scenario based. You are asked around 2 to 3 scenarios based upon the specialty you are applying for, and you have to answer the relevant questions. You you should expect 1 to 2 research related questions as well, and you should have a solid reason uh, to give that why are you moving to UK. So after the interview, if you are successful, you will receive an email within 10 working days, and in that email you will be guided how to apply for GMC registration and how to get RCP appointment and how to submit the RCP appointment fee. Once you have made an account for GMC registration and you get a GMC registration, then you will have to email back your GMC number, and then the college, it will arrange a certificate of sponsorship which will be sent to you, and then you can start your visa application process. Just to clarify that you will get a Tier 5 family dependent visa for MTI post. So this was all about the eligibility, about the application process, and the interview. Now at the end we'll just superficially discuss the pros and cons of working as an MTI doctor in UK. So let's start with the pros. The first and most important is that you get a full GMC registration without exams like PLAB. You get to work for 2 years in a NHS setup, and you gain a quality experience, and the pay check, it is reasonable as compared to the native countries, especially if you are from a developing country. But the most important thing, which I personally think, is that if you are able to get through your MRCP exam during these 2 years, you have a fair opportunity to apply for CCT, as well as you can apply for non-training job, trust grade jobs in UK. But if you are from medical specialty, you must concentrate on clearing the MRCP exam and applying for CCT training. Now the drawbacks, obviously you'll get a Tier 5 visa, which doesn't count in your ILR or British citizenship. The pay, it is a bit lower as compared to the local graduates, and another important thing is the environment, the working environment. It is a bit challenging because you are moving to a different country with different cultures and different values. uh, there are issues with lawsuits, and there is constant GMC monitoring. So you have to adjust to this challenging work environment unless you have worked in a state of the art hospital previously. So this is all about the MTI process. I hope the video would be beneficial. If you like our videos, subscribe to our channel and stay tuned for more videos. If you have any further questions, you can ask under the comment section. Thank you and take care till next time.